So, what I would have loved to have known from a loved one's passing was definitely my grandmother. My grandmother was 84 years old when she passed away, and she was in good health. We didn't talk about death. She would say, "I'm going to die. I'm getting older." But we never really had that conversation. I was so much younger than I am now, and I didn't know the things I know now. When she did pass away, though, we didn't have anything planned. So it was such a rush to get things done. And she had a beautiful passing. She passed away in her sleep, which is, what everybody wants, what I want. But I wish that we had talked about more about her passing and how she would have wanted things, what kind of flowers she wanted, um, what type of funeral arrangements. I mean, we were Catholic, and it's pretty standard, but I just wish we would have had more of a conversation around that. And I think me being young and her being older and wanting to protect me from that, I do wish that I was more aware of it at an earlier age and been able to have that conversation with my grandmother. What I would love my loved ones to know about my end of life is that, number 1, I love them very, very, very much, and because of that, I don't want them to have a traumatic experience. I have taken care of all the planning. I have documented it. I've expressed it. We have all discussed it. They all know. They think I'm too young, but things happen, disease happens, accidents happen, and I want them to know that I have taken care of the arrangements. I've taken care of the finances. They even know if I'm allowed an opportunity to pass at home that I want my dogs with me. I want hydrangeas in the room because those are my favorite flowers. I want candles lit. I want it to be a peaceful experience. In my culture, we tend to have everybody in the room at vigil, and I don't want that. And I've expressed to them that it's okay. I don't need that. That's too difficult, I think, for loved ones to all be there and already mourning before you've even passed. I don't want that. I want a few people. I want I want love and laughter, and tears can flow. That's okay, but I don't want it to be a traumatic experience where they look back and they think, "Oh, that was hard." I want them to look back and think, "Oh, that was beautiful." So I'm a death doula, and I chose to become a death doula because I was working in the elder care community, and I noticed that there was a slight disconnect between hospice and families at end of life. And so I sought out information and training and did that, and I fell in love with it. I used to fear death. I used to fear my own death, and that died, I didn't know how to support them. I didn't know how to support the dying, and it's been so life-changing for me knowing the death process and just being in that space, being familiar, having those conversations with people, it's really alleviated my anxiety around my own death, and those that have. Actually, just a couple days ago, my uncle, who lives in Canada, passed away, and sadly, he passed away in the ICU room. It wasn't a beautiful death, unfortunately. But we were able to support our family members and hold space for them and love on them. And we all, as sad as it was, we accepted that that's what happened, and that was the natural process. And again, unfortunately, not a beautiful death, but I do have an example of a beautiful death, and it's with the client that I was working with. When I started working with her, she was not terminal. She didn't have a terminal diagnosis. And then something happened, and she did. She had cancer. And so what we did was we had many, many conversations around what she wanted. And she had already thought this through. Her husband had passed away. She had thoughts and ideas and beautiful stories. And we did a life review with her where we talked about how she met her husband and how many kids she had and grandkids. And she just went through her life, and we asked her if she had any regrets or anybody she wanted to say final goodbye to. We really didn't know when her final days would be because she wasn't transitioning. And she mentioned a sister that she hadn't spoken to in 20 years. So we reached out to her sister. We found her on Facebook and reached out to her and asked if she would be willing to have a conversation with her over FaceTime. And she said yes. So we did, and they had like a 40-minute long conversation, and it was beautiful. And everybody cried that was in the room because it was just the sweetest thing ever. And when she was done with that conversation, we asked her, we said, Miss Nancy, would you like to do that again next week? And she said, no. I said what I wanted to say to her. It was lovely. I have nothing else to say to her. I said goodbye. And throughout the rest of her days, that's how we approached it. She said her goodbyes and she was ready. And on her final day, we weren't shocked. We were prepared, we were ready, and it was so beautiful that everything had been said. Nothing was left unspoken. All the I love yous, all the goodbyes, all the prayers and her wishes. And she even told her husband, I'm not ready to join you yet. I want a few more days to love on my family. And that was just so beautiful.